Well, hospitals around the region have been gearing up for a surge of patients with potential cases of the coronavirus known as COVID-19. Those patients would have to be isolated and treated with special equipment.
Health reporter Stephanie Stahl is here with that part of our coverage tonight.
Checking in with hospitals, guys. You know, doctors say for people who are sick, they should first call their doctor unless they are experiencing serious symptoms. People with potential cases of COVID-19 are usually told to self-isolate in their homes. But what happens if they end up in a hospital? It might look like a standard treatment room in an emergency department, but it's not.
The air inside this room is taken and vented directly outside through a special filter to make sure that nobody in the hospital is exposed.
This is a negative pressure isolation room at Lankenau's emergency department. This is where potential coronavirus patients would be treated. And anybody that comes in this room is in full protective gear.
100% protective gear to make sure that they do not contract the virus.
Dr. Jonathan Stahl with Mainline Health says quickly identifying and isolating potential coronavirus patients is critical.
We would first evaluate you to see if you even need to be in the hospital. Most patients can go home and be isolated at home.
So far, it appears coronavirus is dangerous, potentially deadly, mainly for the elderly and people who are already sick. There is no treatment for the virus, just supportive care if needed. And it can be spread even when people don't have symptoms, which are a fever and cough. To guard against infection, experts say people should be aware of something called community distancing.
People should be apart a little bit. So ideally at least 3 feet, but the CDC is actually recommending about 6 feet. The most important thing, and I can't stress this enough, is to wash your hands. That is the best thing to prevent you getting coronavirus.
And not touching your face.
And not touching your face. So if you go, and people do that, you touch your face multiple times a day and you don't even realize it.
So the virus enters the body either through your nose, mouth, or eyes, which is why it's important to try to not touch your face and keep your hands clean. And so far, we can tell you the cases we're hearing about all appear to be mild, which is good news so far.
Yeah, that is good news.
Thank you.